welcome back to CareWorks RN. This is Dr. White. I am here to talk about bug bites today. And so when we talk about bug bites, we're talking about all those insects that can be quite a nuisance during all year, but really in the summer months. So we're talking about mosquitoes and fleas and spiders and bees and wasps and ticks. All of them can carry viruses and bacteria that can make you really, really ill. So one of the things that we can do to help protect ourselves is this. We can wear long sleeve clothing like the shirt I have on here. Now, of course, when it's 90 plus degrees outside, this can be quite uncomfortable. However, if you're in a wooded area, you might want to wear a long sleeve shirt, long sleeve pants to help protect yourself. In addition to that, you can look at insect repellents, and there are two types. One has DEET, D-E-E-T, and it'll look like this. This is an example. This is off, which probably many of us have grown up on. Well, this particular insect repellent has DEET, and DEET is a chemical. And when I looked up the information from the EPA to try to determine why people were afraid of DEET, then what it said was this, is that as long as it is used in accordance to the instructions on the container, then it's safe. However, there is still a warning label here that has many precautionary statements. And so I say to you to consider that, make your own personal judgment as what's safe for you and your family. But another insect repellent that I found was plant-based, and it's all natural. And this one is called Everspring, and I picked it up at Target. And when I look at the ingredients, it's citronella, lemongrass, cedarwood, all natural products, so it doesn't have any chemicals in it. So for my personal choice, I am going to select an insect repellent that doesn't have DEET in it, because whenever I see some sort of precautionary tale, then to me that says that something could happen. Okay, so just keep that information in mind. The best thing is to make sure that you're using something. So what I want to share with you is a personal story about a mosquito bite. My sister is a 64-year-old woman, was in her normal state of health, and this would have happened in 2020, along the same time as COVID. And so she started feeling sick, like she had a stomach virus. Went to the emergency room, they treated the symptoms, sent her back home. Well, a few days later, still didn't feel so good, was losing a lot of weight really quickly, and wasn't trying to lose weight. Went back to the emergency room, they treated her symptoms again, sent her back home. The third time she went to the emergency room, she actually had some heart symptoms or cardiac symptoms where her heart was racing. And at that point, they did admit her. So during the admission, they took all types of tests, couldn't figure out what was wrong with her, but she got progressively confused. Now, this is a 64-year-old woman who was just like you and me, went to work, grocery store, handled her business, you know, all of those types of things. So there was no neuro deficit prior to this. So she stayed in the hospital for a number of days with all types of tests for them trying to figure out what was wrong with her. Didn't really come up with anything, but she got progressively weaker, so they ended up sending her to rehabilitation, where they were going to do some strengthening so that she could return back home. Well, in rehab, remember this was during COVID, so family couldn't see her because the rules were so strict at that point. So in rehab, she developed more weakness. My guess is that she probably wasn't seen because she was confused. She ended up with a bed sore. Now, this is a 64-year-old female who was used to being ambulatory, didn't have any problems at all, and ended up with what we know as a stage 4 bed sore. And so the wound was so deep that you could even see her bone. And so that says to us in healthcare that there was no movement, and she was unable to move herself. So again, progressively worse. Finally, a doctor saw her in rehabilitation, and they sent her back to the hospital. But mind you, this was 60 days later from her discharge. So she got back to the hospital. The a doctor from the emergency room called and said that, you know, this is just crazy. He had never seen anything like it. So she got admitted. They did surgery on the wound to clean it out because apparently it was awful. I do have pictures, but I won't gross you out with those. So she met a neurologist, and the neurologist instantly thought West Nile virus. Okay, but it had to be confirmed with several tests, including taking a sample from her cerebral spinal fluid or a part of the fluid that serves both your spinal column and your brain. Well, it did come back positive for West Nile virus, and that was her diagnosis from just being bit by a mosquito. So this was 3 years ago, and she is still recovering. Thank God. She is significantly better. There's no confusion. She's able to handle her own business again, but she still needs assistance with walking. Her legs got so weak from being in bed for that length of time. And so I share my personal story with you because this is something really near and dear to my heart. We think so frequently of these ticks, and ticks cause Lyme disease, which can end up with some very similar symptoms. But we think nothing of it because, for the most part, then we're fine. It's itchy, it's irritable, and it goes away. So I say this to you because this happened to her. That just to be a little more careful this summer, make sure you use your insect repellent. Wear long sleeves if you can tolerate the heat, especially if you're in a wooded area. If you have a pet, check them for ticks. Check yourself for ticks. If you're removing a tick, remove the entire tick. Make sure you're grabbing it from the body and not just from an end, because if some of the body stays in you, that can create another infection. So stay healthy. I wish you a happy summer, good vacations, and all of those things. And just felt it was great to be able to share that story with you, and such that you and your family can stay protected.